morning everyone, my name is Marissa and I've been a beauty therapist for 8 years. I still love the industry and have a huge passion for it, which is why I've started teaching. Obviously you all have the same passion or you wouldn't be here today. By the end of this session you will have a better understanding of identifying contraindications and appropriately referring your client for the right treatment. Before I start, I'll go over the evacuation procedures. I'll just hand out some notes. For you guys to quickly read over. Just pass it back when you're done. So there is an exit here and there. There is a phone over here and a first aid kit behind there as well if there happens to be an emergency, which hopefully today we won't have any. Now, some ground rules. I would like to ask that you all respect each other and listen, and it's an adult learning environment so there's no second chances. Any questions to begin? I'll quickly go around and just introduce yourself and how long you've been in the industry. Please.
Hi, I'm Sarah. I'm new to the industry.
No, this is meant to be. Just make up any years.
Like,
Are you able to cut that out? Sorry.
Yeah, 3 years I've been in the industry.
Yeah.
I've been in the industry 10 years.
Your name?
Hayley.
Yeah.
My name's Megan. I've been in the industry for 9 years.
My name's Elena and I've been in the industry for 2 years.
Hi, my name is Judy and I've been in the industry for 30 years.
My name's Jane and I've been in the industry for 5 years.
My name's Anne and I've been on 3 years.
Great, so, and at the back there?
Simon and I've been in the industry for a whole 6 months.
Great, thank you everybody. So we all know a little bit about each other. Now, I'm just going to hand out some information on contraindications. You should all be a little bit familiar with this already. I'm just going to get your knowledge up to scratch. There you go. Thank you. Sorry. There we go. Now, can I get a volunteer to start reading, please?
I'll do it.
Thank you, Jade.
Non-contagious conditions.
Yep.
Where do you want me to read to?
Just the end of that dot points, yeah.
Allergic reactions, any history of sensitivity, bruising, dermatitis and inflammation of the skin. There are 3 main types. Contact dermatitis, reactions to various substances and chemicals. Atopic dermatitis, a chronic inflammation in people with a tendency towards allergies.
What's that one?
Does anyone know what it is?
If you tell me how to say it, I'll be able to say it. I've never heard of it. Seborrheic dermatitis, a reddish skin inflammation in areas with large numbers of sebaceous glands. Eczema, an inflammation of the skin, chiefly by redness or itching. Folliculitis, infection of one or more hair follicles caused by bacteria. I've never heard of this.
That's fine, I'm sure somebody
Heavy
in the
growth
group
of
will.
hair.
If you know what the answer is, feel free to offer up your help.
Abnormally excessive growth of terminal hair for the sex, age and race. Insect bites, mosquito, bee, wasp, chigger, ticks and spiders.
Okay, so these are all non-contagious conditions that could be found on or around the eyes that would prevent you from doing your lash and brow treatments. Just to the next page now. Any other volunteers? Yeah, thank you, Megan.
Contraindications to lash and brow treatments. Eyelash and eyebrow tinting contraindications that prevent an eye treatment from being carried out. Conjunctivitis, stye, blepharitis, viral infections, bruising to the area, reaction to a patch test for tinting and perming. Immediate aftercare advice. Do not touch or rub the area immediately after treatment. Cooling mild antiseptic products, example witch hazel, should be applied to the area. No makeup should be applied to the area for 12 hours as the follicles are open and infection may occur. If redness or irritation occurs, apply a damp cotton wool pad to the area. This effect will last approximately 4 to 6 weeks, depending on how quickly the hair grows out. Stray regrowth hairs can be removed at intervals to prolong the effect of the eyebrow shaping. Strong sunlight will make the results fade faster.
Contraindications that prevent waxing. Contagious skin conditions. Wait for the condition to clear before waxing. Thin or fragile skin. Can cause bruising and tearing of the skin, which may lead to infection. Use of steroid medication. This can cause a thinning of the skin. Waxing should not be done whilst using such medication and not until 3 months after completing the treatment. Unidentified lumps or swelling. Previous allergic reaction to the treatment.
Thanks.
Contraindications that may restrict waxing. Raised moles and skin tags. Wax should not be applied directly over them. Abrasions, bites, broken skin, bruises. Avoid waxing the affected area until healed. Varicose veins. Do not wax over the affected area.
Immediate aftercare. The waxed area may be red and there may be some blood spots, especially where the hairs are strong, i.e. on the bikini line or underarm. An after-wax cream containing aloe vera will be applied to help cool the skin, reduce the redness and keep the skin moisturised. Aftercare for a period of 24 hours following treatment. No sunbathing or sunbeds. Avoid bathing in sea or swimming pool. Do not take a hot bath or shower. A cool one is absolutely fine. Do not use deodorant, antiperspirant, and avoid tight clothing. Do not use perfume products in the area, no makeup or self-turning preparations. Do not keep touching or pricking at the area.
Great, thank you. Are there any questions on any contagious or non-contagious conditions that will prevent you doing an eye treatment? Is everyone familiar with those contraindications or want to add anything to that list?
There's a few big words in the first one that we didn't understand.
Yeah.
So, the seborrheic dermatitis, which is just a reddish inflammation of the skin. Obviously, if there's any red inflammation around the eye area, I'd be advised not to perform any tinting or waxing on that area. Which brings us to our next section of the lesson, referring your client to the appropriate treatment if you come across any of these conditions. So to do that today, we're going to do some role play. I'm going to get you to pair up, just face each other as pairs.
We'll go through
Three. Now, the most important thing to remember is to stay polite and always keep your client calm and don't cause alarm for them. So just a quick demonstration, if you notice a mole that might look suspicious on somebody's around their face, especially around their nose and cheek area, then the polite thing to do would be to refer them to go and get it checked, or just ask when the last time they've had their skin checked for skin cancers, because it is such a common thing in Australia and some people don't think to go and get things checked. If you as a skin therapist notice anything suspicious, then it's your duty of care to refer them to their doctor to get it checked. So that's just one example. So if you want to just pick one contagious or non-contagious skin condition and do a quick role play with each other while I just observe. So you're coming for an eye treatment and you've noticed that Sarah's got a little bit of conjunctivitis in one eye and she wants an eyelash tint.
Sarah, unfortunately today we can't do the treatment. Can't do that.
Yeah, so you might want to start by just Sarah, were you aware that you've got a little bit of an infection in your eye today?
Oh yeah, I thought it was no big deal.
So there's a little tiny bit of pus there which could indicate that it's conjunctivitis, which prevents me from performing the treatment on you today. Best thing for you would be to, if you can get into your doctor and get it checked, they might be able to prescribe you a cream that should heal it up straight away. And then once it's all clear, you're welcome to come back and receive your treatment.
Okay, no worries.
Awesome, we'll see you next time. So that's another, just a little example. How's everybody else going? You feel confident? Yes, please.
So Megan, have you used any kind of new products or anything on your face the last few weeks?
Yeah, I've used some acne cream.
Yeah, it looks like it's just burnt your skin a little bit, and I just feel a little bit reluctant to wax over that area because the skin's a little bit inflamed and peeling. So yeah, don't be alarmed, but the best thing to do would be just to go to your doctor and see if they can give you any creams or anything like that.
Some eye drops over the counter.
Okay.
So you also want to recommend when it comes to topical skin treatments
That'd be great.
that they wait up to 3 months
Thank you.
after they stop the treatment before they receive any waxing.
So cut that.
That's really good, guys. Just come and check how you guys are going.
Oh, we just did it.
Oh,
Do you want to just do it again for me, please?
sure.
Should be better the second time.
So you were having an eyelash trim today, Judy?
Yes,
Yeah,
I
so
am.
I can see that you've got a little bit of pus around your eye.
Oh, really?
Yeah,
Oh,
yeah. So
that's
unfortunately
awful.
we won't be able to do it because it can spread. It is quite contagious.
Oh, really?
Yeah, so
Oh.
what I'll get you to do is you can just pop around to the chemist and they can give you some eye drops over the counter, and hopefully in a week you can come back and have your eyelash tin.
Oh, okay.
So we can rebook you when we pop out the front.
All right, that'd be
Okay.
lovely.
Not
Thank
a
you.
problem, no worries.
Great, thanks guys. And does everyone feel confident with their identifying contraindications and referring your client to the right treatment?
Yes.
Any questions? Okay. I'm just going to hand out this short answer question. You've got 5 minutes to do it.
Thank you. Oh, I've got to.
There we go. Do you all have a pen? Yes, question.
So are we just reading this?
Just
and then you'll-
answering the short questions.
What's your question?
Oh, yep, on the back, Judy.
Oh, sorry. I forgot to do that. Okay, how did everybody go? Very good.
Great, I'll just collect those now. Thank you. I'll just reach over, sorry. Thank you. Okay, so that completes our training session on contraindications for eyelash and eyebrow treatments. If you have any further questions, feel free to speak to me after the class, and we'll see you next time. Thank you.